No. You should only speak in therapy about what you're comfortable with. However, what I would advise is that within therapy, it is the safest place to start speaking about your abuse. If there are things that you still want to discover or things you want to go back over for yourself and to process and move forward, it is the safest place, though there is no pressure to actually speak about the abuse itself. Therapy helped me in many ways, not just in terms of sexual abuse. It helped me to grow my self-confidence, to grow as a person, to actually really hone in on who I want to be and the contribution that I want to give to the world. It gave me more of a sense of purpose than I had before. I would say there's no perfect time to start therapy. Obviously, we're all going to therapy because we need help in some aspects of our life. I would say when's not the right time would be when, for me personally, I would find it when I'm in a really heightened emotional state constantly. I would try and seek immediate advice and supervision aside from the therapy, as therapy isn't just a cure, a straight cure. You don't just go to one session and there's, a big bandage around you. It takes time and can actually provoke more emotions, and it's a roller coaster, and you don't want to go any further down if that further down is potentially dangerous for you. For me personally, as a survivor, I struggled with a great deal of anxiety. I struggled getting close to people. I'm someone, because of my past, will be very standoffish with people. I don't like to allow myself to get close. I don't want to be close enough to someone for them to hurt me. Struggles that I found for therapy. Personally, I want a therapist who is LGBT. I would like for them to have knowledge of the experiences that I've gone through as an LGBT person myself, respect that, respect my pronouns, respect me as a whole, and make me feel more comfortable. It took me a good few attempts to actually find a therapist that I felt comfortable enough with. I don't personally believe so. I've had the thought myself that I'm stopping someone who may be more deserving. I think being a survivor, we all need some sort of therapy. We all need some assistance to manage our struggles and to make sure that we can get through day-to-day activities and live a normal, happy life. I think we're all very deserving of therapy, and I think there are services out there that if someone was in desperate need of therapy, they can access them as well. What really helped me outside of therapy was finding different and creative ways to express myself. I'm a performer. I sing, I dance, I act, I do my nails, I do my makeup. I immerse myself in creativity, culture and art, as that's really been an escape for me to find joy and find happiness. For anyone who's not started therapy, I would just give the advice of being kind to yourself, being patient. It's not always easiest or safest to start therapy and say everything that's really on your mind and has really happened to you in the past. To just take a deep breath, assess your options, make sure your therapy is right for you, that you have enough of a relationship with your therapist, and that you're comfortable. Because when you're comfortable, you will naturally express more than if you weren't comfortable, and you may hold back at times.